Yeah, so you was telling me you contracted from a 12-year-old girl. Were you treating this girl?
Yeah,
When did you?
that girl was brought at A&E, accident and emergency,
Mm,
and that girl had joint pains.
mm,
She had generalized body weakness.
mm.
She had drenching night sweats. The mother was telling me she had drenching night sweats.
Okay.
Then she had blood diarrhea. All of those symptoms they were for 4 days.
Mm,
Yeah. Then I tried to assess. I did my clinical assessment and general clinical assessment.
mm,
I found the girl had a moderate dehydration.
mm,
So I cannulated the girl. I put maintenance fluids and some antibiotics.
mm,
I can remember I gave her IV ciprofloxacin.
mm.
Yes, because for my thought I didn't know that it was a hemorrhagic disease.
Mm,
Yeah. So on the following day, then when I gave the treatment
mm,
in the around 6,
mm.
that girl died, passed away.
On the same day that she was brought to hospital.
Yes.
Okay.
So they called me. When you're treating a patient and that patient dies, you have to make a report.
Mm,
It's done routinely. If you treating a patient and that patient dies, you have to make a report how you treated, which drugs you gave,
mm,
for clarification of the caretakers and justifying what you give to the patient.
mm. So at this point, had the outbreak been declared or not?
They had taken a sample from a 25-year-old man who was at another ward, male ward.
Mm,
That man had the generalized body weakness and the hemoptysis, like nasal bleeding,
mm. So you suspected and took a sample.
yes, that day on Monday.
Mm,
And that guy had the water diarrhea. For him, he didn't have blood diarrhea,
mm.
but he had nasal bleeding
Okay.
that was not relieved by any medication.
Mm.
Then you know that
And you had checked for all these other major diseases and negative, like malaria, these other fevers.
of course when a patient is brought at A&E,
Mm,
as a kid you have to first do MRDT, the one for malaria.
mm,
As we were waiting for the CBC, complete blood count, to see the other, if there is any infection, what and what.
mm.
It takes some time.
Okay.
Yeah, when the complete blood count, when I got the results, showed leukocytosis,
What is that?
the high levels of leukocytes.
Okay. What
That,
what are leukocytes?
leukocytes,
Uh,
those are white blood cells that when they increase, they indicate an infection in someone's system or blood.
mm,
Yeah.
okay.
So for my was treating as an infection.
Mm,
You get it?
mm,
Yeah. So when they took a sample, it took like 48 hours.
mm,
From the other 25-year-old male,
mm.
so they were saying there is a case of hemorrhagic fever, but it was not, they had not gotten the results, so there was no worry about that.
So you kept monitoring and managing these symptoms as they came.
Yes, for the kid.
Mm,
Unfortunately, I lost the kid at around 6. That's when the kid died,
mm,
and I made a report.
mm,
So in the morning, Tuesday morning,
mm.
I started getting the symptoms.
Yourself.
Yes, because I was the first person, a health worker, to be isolated.
What
You know,
symptoms did you get at the start?
in the morning, I woke up at around 6 to bathe and go for work because I was on morning duty. I had severe headache. I had the high grade fevers. The temperature was 40 degrees Celsius. I had the generalized body weakness. I had the joint pains. Yeah, those are the symptoms I had. I had no sweat. I had not started sweating. The step of sweating and vomiting and loss of appetite. They came the following day on Wednesday. Yeah, those are the symptoms I had on Tuesday.
Okay.
Yeah.
So then, when you had these symptoms,
I went.
results were not yet back
The results of
for the patient. For the patient.
yes, the other patient.
So you went back to work.
I went back to work. I did my RD, MRD. I took a sample from one of my colleagues. Took a sample. They did my RD. They did wide is typhoid, enteric fever. They did wido. They did the CBC. They did the urinalysis to check if there is any UTI. Because it also causes high grade fevers. All were negative. Even the leukocytosis even the leukocytes were not high. Yeah, all my results were okay. I had no any indication of any infection or disease.
Okay.
So I kept worrying. I worked that day. I took some paracetamol, oral paracetamol, that relieved a bit the headache, but the fevers were there. Yeah.
Okay. So you work that day, and the following day, did the symptoms get worse? What happened the following day?
Yes, the following day, on addition of those symptoms I had on Tuesday, I had drenching night sweats.
Okay.
When, but that's Wednesday evening. Results came back of the other guy, and they were positive. So when you get an outbreak, everyone was on fear. Yeah, people started worrying. We started the measures.
Because you knew that you had gotten in touch with these patients.
Yes, so everyone was on fear actually. But for me, I didn't take it as serious. No, because of the CBC, I thought it was an infection. I didn't take it so serious because I had very many patients that day. Yeah, I had very many patients, so I could not think of the other kid I got in the morning to be the one that I contracted the virus from.
Okay.
Yeah, so Wednesday morning, everything was worse.
Your symptoms had become worse.
Yes, drenching. I had a drenching night sweats that Wednesday night. Drenching night sweats. The headache was not relieved by paracetamol. Everything was not okay. I lost appetite. I could even not move well. I had dizziness.
Did you still go back to work on that Wednesday?
Yes, because I had to go. It was my week. I was on duty. I had to go back.
But with a lot of difficulty.
Yeah, absolutely, because I could not tell people that my seniors or my supervisor that I'm sick. Yeah, they question us a lot. When you have seniors who are there is a
They told me the Mubende people are not very, very easy to work with.
yes, mostly those consultants. Yeah, they are always aware, and you have to come in and cover up. Yeah, so I had to go back and work.
Okay.
So I started worrying. Then on Thursday, I got some. I felt everything was. I started feeling too much. Too much dizziness. I could just stand and I feel like, as someone who has a postural hypotension, I don't know whether you know it. Or like when you stand up,
Mm.
after when you have, let's say you have seated for a long time,
Mm.
then you stand up, you feel like you want to fall down.
Mm.
That
Yes,
dizziness.
yes.
We call it postural hypotension.
Mm.
So I said it. So now I started thinking about to now hydrating myself because I was sweating a lot, even during the day.
Hydrating yourself like IV or water.
Yeah, yes, IV fluids.
Mm.
So I put a cannula. My colleague put a cannula. I ran 2 liters of normal saline.
Mm.
So I started feeding a bit, okay.
Mm.
But I had lost appetite.
Yes.
However, I had no vomiting. I had no diarrhea.
Mm.
And I had a normal pass out of stool.
Mm. That's on Thursday.
That is Saturday. Then Thursday night,
Mm.
Thursday night, everything became worse. So I called my colleague,
Mm.
the one who tried to to to
Give you the
help me put the IV fluids and what.
yes.
That's now he also contracted from me.
Oh.
Yeah, that colleague of mine called him Kwasibwa, but the one because we are two students, then others were surgeons.
Mm.
Yeah. So everything became worse. On Friday, I could not even walk. I could not move out of the bed.
Mm.
So Herbert called people of the surveillance team.
Mm. By Friday, the outbreak had been declared. And I
Yes.
think that's the time when we were hearing health workers. Was that the time when health workers were saying they want to, the Mubende interns were saying they want to go on strike or something?
Because there were no, those people, I don't know what, in fact, they are the one who brought all the problems to us.
Mm. How so?
They would want us to go and work without any measure. The PPEs, they could not give us the PPEs,
Mm.
and they want us to go there and work.
Mm.
So in medicine we have what can I call it? It's like army. When your senior says you go,
Mm. You
eh?
have to just
you
go.
have you have no say.
Mm.
So we are helped by those interns who tried to refuse and to write a letter. What?
Mm.
Those are the people who helped us.
Okay.
Mm. So they tried it. So that's when you had that saga of interns being pushed by their seniors to go and work without any measure protection.
Mm.
Yeah. So on Friday they brought the surveillance team. They took me. They got a sample from me. By morning, the Saturday morning, the results were out,
Mm.
and I was positive. But that time, I was feeling. I don't know how I can. I had, sweating as if I don't know, sweating with chills and rigors.
That's shivering.
Yes,
Mm.
I had no appetite. I had spent like 3 days without eating,
Mm.
so I was very hungry with chills and rigors, sweating. A headache was too much. It could not be even relieved by paracetamol because even the IV paracetamol could not work.
Mm. So on Saturday, you were you in now in the hospital, or were you still at home?
No, they took me to hospital on Friday.
Okay.
They took a sample and they retained me in the hospital. We have an emergency room
Mm.
for health workers in case of any outbreak. There is a room for us.
Yeah. So they
They
put
put
you there
they put
and
yes,
started giving you IV.
yes
And
they put me they put me on IV paracetamol,
mm.
and I didn't have any relief.
Mm.
Yeah, things were worse. So they tried to give me maintenance fluids because I was dehydrated. Mm. Because of too much sweating.
Yeah. You
Yeah, those drenching sweating, so they tried to replace.
mm.
Yeah.
So after your result comes out positive, what happens? Where do you go? By that time, were the PPEs in? Had they created the ETU?
Yeah, they had created the ETU.
Mm.
Yeah, they had created the ETU. Then now, on Friday, the interns vacated the hospital now.
They just left and went home.
Yes. After that report,
Mm.
they left and vacated then this the nurses took over and the doctors,
Okay.
the ones who had PPEs.
Mm.
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 So when my results came out, I was positive. They isolated me. They took me to the ETU,
Mm.
but I was mixed with people, other people from Maduda and where I found there very many people
Mm.
because the tent had the 6 beds.
Okay.
Mm.
So you were there with 5 other people.
Yes, we were 4.
Okay.
Yeah.
Mm. So tell me about the ETU. How was the starting on Saturday? How was the treatment, and how did your symptoms progress? What kind of other symptoms did you get?
Actually, when they took me to ET, everything became worse again.
Mm.
You
How?
know that type of it was like a tent,
Mm.
and they took me there at around it was in the evening.
Mm.
Yeah, it was in the evening. That day it had rained. The tent was cold. I had no appetite. They brought food. I didn't eat.
Mm.
The headache increased. The sweating, general body weakness. I could not even move and go and go to the toilet. I would just urinate in the bucket they gave me and defecate there.
Mm.
Yeah. So the health workers came in at around midnight.
Mm.
Yeah.
On you.
Yes.
Mm.
They gave me some IV fluids. I reckon it was 1 liter.
Yeah.
Then IV paracetamol
Mm.
and IV metronidazole fragile,
Mm. Mm.
500 milligrams.
Mm.
Mm.
That was in Mubende.
Mubende.
Then we also we got a report from Mubende at that time that there was problems with the medical. By that time, had the other medical workers also joined you in the ETU or not yet?
Not yet.
Okay, so how when did they join?
They joined me on the following day.
Mm.
They joined me on the following day. Then they separated us. They had constructed another ETU,
Mm.
like another tent.
Okay.
So they put us in that tent. That following day they brought two. Here is the 2 surgeons. One intern and one surgeon.
Mm.
Dr. Muhammad who died.
Okay.
So when they brought them, they were not comfortable with the press,
Mm.
with the ETU.
Mm.
So they tried to explain to these doctors who came in.
Yeah.
So when they explained, that's how we got to move to. That's when we moved to Fort Potro
Okay.
after them complaining.
So, just to take you back a little bit, when Dr. Muhammad died,
Mhm.
what was the mood in the ETU for you medical workers who knew him and had worked with him?
No, he didn't die from Mubende.
Mm.
Yes.
Okay.
It was on Sunday
Mm.
when they brought Dr. Muhammad and one of the interns, Dr. Kunsa.
Mm.
Then on Monday, They had a meeting
Mm,
to transfer us from Mubende to Fort Potro.
mm,
Yes. When we reached there, they brought other two surgeons and one anesthetist.
mm.
Yes.
And that's where Dr. Muhammad died from.
Yes.
How did that treat you?
It was too terrible when Muhammad died. For me, to tell you the truth, because I was the one who I was the one who, because in the ETU of Fort Potro,
Mm,
they are sleeping two in one room, two people in one room.
yeah.
Yeah, so I was with him in the room.
Mm,
So the symptoms the symptoms he got very severe symptoms of blood diarrhea and vomiting of blood.
mm.
Yes. So
So he
and
died
you know, as a
before.
health worker, you know when you're going to die. He told me that I'm very soon I'm going to die.
Wow.
Mm.
And
And it didn't take even a day. It took like 8 hours.
mm,
It was around 3 in the night.
mm.
Mm.
So you watched him pass on.
Yes, very well. We were there. Even the consultants were there. They had come they had come to do the old round.
Mm.
Mm.
What about the other lady who died, sister?
Actually, sister was very okay. He had no he was very okay. The problem was she had the difficulty in breathing,
Mm,
but she didn't have those symptoms of GIT symptoms and high grade fevers.
mm,
Yes, but she was a known hypertensive.
mm, mm.
Yes.
Okay.
Mm.
The what do you think, in your opinion? Okay, what do you know was the worst symptom that you got? Because there are so many other symptoms there for Ebola, but what is that one that really?
The one I got,
Mm,
for me, the worst symptom that I got was high grade fevers and headache.
mm.
Because for me, I didn't vomit. I didn't have diarrhea.
But other people had. Eh?
Yes.
So how did they manage those ones that had diarrhea? Because
You you could just give they could put them on fluids
mm,
and the antibiotics.
okay.
Mm.
What about the diarrhea itself? Because I'm thinking in the ward in the ETU, because for okay, I just want to know how severe is this diarrhea? Because like I've had diarrhea before, so you can diarrhea like twice a day or once.
Ah, my brother,
Mm,
the other diarrhea you could die because now the diarrhea of Ebola
mm,
you cannot even stop it and go to toilet.
really?
Yes, they had pampers.
Mm,
So I can tell you they could wet the pamper within 1 hour. The pump is already full.
mm,
Yes. So they could change the pampers like every 1 hour, every 1 hour.
mm.
Yes, because this diarrhea of Ebola, you cannot stop it.
What?
Yeah, it's you cannot stop
It
the
just goes
sphincter.
through.
The sphincters are they all relax because of the shivering.
Mm,
So the muscles are relaxed. There is no way you could stop.
mm.
It comes direct.
Okay.
Mm.
So that means that place did not really smell very nice. I'm thinking.
Not at all. Those people could come when everything is the bed sheets, the blankets, the what. Actually, I thank those people. They are very trained of Fort Potro.
Mm.
Mm. They tried their level best.
To keep it clean.
Yes.
Mm.
For example, like Muhammad.
Mm.
Yeah, you know, brother Dayoye of almost every like 30 minutes the pump is full.
30 minutes.
Yes.
So that means in a day somebody can direct more than 40 times.
Hey, 40 times, 40 times, those times, 40 times even Rito, 40 times. When Dr. Konsa could, because when I got relieved now,
Mm.
I started helping Dr. Konsa, the intern.
Yeah.
I could change the pamper because I knew he could not reinfect me.
Mm.
Very rare for a reinfection to occur.
Mm. Because you have antibodies.
Yes, I have already generated the antibodies against it.
Mm.
So I would change like every 30 minutes because he was severely ill.
Mm.
He could not even rotate in the bed, like change himself.
Mm.
So to avoid those pressure sores and bed sores, I was the one to change him, put another pamper. So within 30 minutes, I would change the pamper, change him so that he cannot get these bed sores, the pressure sores.
Mm.
Yeah.
Okay.
Mm.
What about eating food?
Actu-
How does it affect your appetite?
Actually, how does it affect the appetite?
Yes.
Yeah, actually, this virus,
Mm.
what it does when it reaches in the body,
Mm.
we have what we call antigen presenting cells, those macrophages. So for it, it hides itself in those macrophages.
Mm.
So when they reach there, for them, the macrophages try to think of like they are normal cells.
Mm.
So after macrophages present, because they are presenting cells, they present to T helper cells and cytotoxic cells. So when those T helper cells are those if when these viruses are presented to T helper cells,
Mm.
these T helper cells try to activate the inflammatory mediators
Mm.
and the cytokines, those interleukin 1, interferon gamma,
Mm.
that go direct to appetite center in the brain
Mm.
and reduce the appetite center.
So that means you get inflamed inside the digestive system. Is that?
No, you don't get you don't. There is no inflammation at all.
Mm.
But those inflammatory mediators, they do a lot of work.
Mm.
They may either, if there is any need, if there is any trauma, like in the GIT, for those who had the blood diarrhea,
Mm.
there is inflammation there.
Okay.
At the same time, they send signals to appetite centers in the brain
Mm.
to try to reduce, to inhibit the appetite stimulation.
Okay.
That's how everything is dismantled, and you feel like you don't have appetite. Actually, when you see food, you feel like vomiting. So
Mm.
it's better you don't smell. They don't bring food near you.
Okay. But then
Yeah.
you had to eat somehow.
Yeah, they had to force us. You eat kosam heroes. What you eat and vomit. You eat and vomit like that.
Mm.
Yeah. Then like for 6 days, like after 6 days, that's when they brought this antiviral, the remdesivir.
Mm.
Actually, it helps us so much.
Mm.
Mm.
Is that the medicine that they said is very rare, the one that they imported?
Yes, the remdesivir.
Mm.
Yeah.
Okay.
For those who were
Gives you,
severely ill, they
gives
had
you.
5 doses.
Mm.
For me, who was just improving, I had 2 doses.
Mm.
So, because it affects the renal system.
Mm.
They had to always check the renal function tests.
Yeah.
Yeah, it's very good, but at the same time, its excretion from the body affects the renal system.
Mm.
Mm.
So at what point did they keep taking tests every day? At what point did you learn that you are now negative?
Like after 3 days without symptoms,
Mm,
and they see at least you bit fairly good.
mm.
Yeah, fairly good and alert. So they take a sample from you. 3 days after the cessation of the symptoms.
So how long did you spend with Ebola total? How many days did you spend positive?
20 like from the
From
day I
time.
contracted it.
Yes.
They are 19 days.
Okay.
Yes.
Mm.
Mm.
So after those 19 days, you are declared your
The,
result
the, first,
is
the
negative.
first the first sample.
Mm,
They took the first sample on the 20th day,
mm,
and I was negative. Like no, like after 3 days of no symptoms of any symptom, either headache, what.
mm,
They took my sample and it was negative.
mm,
Then I spent other 3 days.
mm,
They took another sample and the results were also negative. That's the protocol.
mm.
Yeah.
So after the second sample is when you are released.
Yeah. Actually, they told me to wait for my colleagues
Okay.
because I was the first person to test negative for both of the samples.
Mm,
The ministry came in and that's when they took us to Entebbe now, Grade B hospital, the isolation center.
okay.
Yeah.
Um, when I had COVID, they would spray a lot, wherever you passed or something. Was that the same case for Ebola?
Not at all. Ebola is just in. That's why it's called. It's a contact. You have to get it through contact.
Mm.
Yeah, and you see, COVID-19. It's
Yeah.
spread through air.
Mm.
But Ebola, you cannot get it through air. You have to get into contact with an infected person.
Okay.
Mm.
So they would not spray you a lot, eh?
No, as long as there is a barrier,
Mm.
yeah, where you should stop. We call it a red zone. Yeah, they put a barrier. It's called a red zone.
Mm.
Yeah, you don't move out of that red zone. You remain there.
Okay.
Yeah.
I know that you're a doctor and you've seen, you've witnessed people die, you've
Mm.
seen many patients die, but did you ever fear for yourself while you were in the ETU, or
Yes.
you had Ebola that you're going to die?
Yes.
What thoughts did you have?
Well, of course, as a person, you think of death. I thought I would be the next person because they brought when Muhammad died,
Mm,
they brought in Sister Nabisubi Margaret, the amethyst,
mm.
in my room.
So all the people who died were in your room.
Yes, because now I was now for me I was getting better and improving,
Mm,
so I would help them in case of anything,
okay.
like the middle of the night changing the pampers and what,
Mm,
for these people who were severely ill,
yeah.
and I would monitor them on the monitor to monitor the vitals and put on oxygen.
Mm,
Yeah, that's why she was brought in my room after the death of the surgeon.
mm,
Mm.
okay. So you thought you were the next.
Yeah, I felt bad. I felt isolated. Actually, I called my mom and I tried to explain.
What did you tell your family?
I told them, you just pray. If I come back, we shall testify.
Mm,
If I don't come back, that's how God has decided.
okay.
Because you could see death near you, just there.
Mm,
Mm. And I tried to tell my friends and colleagues. Actually, I called them, others I just posted on WhatsApp my status.
mm,
In case of whoever I did bad, they just forgive me and I rest in peace.
mm.
And actually, after Sister Nabisubi's death, symptoms came back because of the fear and the stress. You know, when the stress comes in, the immunity is lowered. Yeah, and now that some symptoms came in, the symptoms that had gone, they came in like headache and fevers.
Yeah.
So when that's what happened.
How did this treat your family? You know, how did they?
They were stressed, of course, you know, as a family.
Mm,
Yeah, they were stressed.
people are crying and.
Yeah. But some for those who I knew that they when they called me, they would start crying. I would not pick.
Mm,
Yeah.
okay.
Mm.
Then, what about stigma after you are negative? How is your life right now?
My life is okay now that they have seen me. Actually, the first day
Mm,
they tried to they were scared.
yeah.
Actually, they were not scared of me infecting them with Ebola.
Mm,
But they were scared of as if they were seeing a ghost because they knew I would not come back.
mm,
So everyone is like, you're not the one. I think this is another person because for them the mentality is like when you get Ebola, the fatality rate, it's 100%.
mm.
Yes.
Be-
Mm.
Well, right now, what are you most let's say most thankful for after
Like
the.
I of course I thank God. The first person to thank.
Mm,
He's the one who manages everything. He's the controller.
yeah.
Yeah. If I thank God, I thank my colleagues who tried to save our lives.
Mm,
To give us the best medical care at least everyone could get if you wish that person to come back in life.
yeah. Yeah.
Mm. Then I thank my friends who tried to give me everything I wanted.
Mm,
I would just call and they bring.
okay.
Then I also thank the ministry also tried. I also thank the ministry, though it came in late.
Mm,
Yes, it came in late and you know, we shall not always blame it so much. You know how you are Ugandan. You know how things move.
yeah.
That one I cannot try to explain to you.
Mm.
Mm.
So gonna go back to work?
Yes, but they have closed. They have put a lockdown.
So you are actually willing to go back and treat Ebola patients?
Yes, next week actually we are going back, but they have told us that we can wait for 21 days.
Mm.
For the survivors that we are free to be at home for these 21 days.
So you're not scared of the disease? It almost.
I'm not because I know the pathogenesis and I know how the prognosis after becoming a survivor.
Mm,
I know how things move. I am not scared. Even if I touch on a patient now.
mm,
Of course, I protect myself,
mm.
but now I'm more protected compared to these people who their bodies are naive to Ebola.
Okay.
Mm.
All right. Thank you very much. Is there anything that I've not asked you that you would probably want us to include?
Uh, um, Maybe
Mm,
what I can add
mm,
is that fear after they diagnose you with Ebola.
mm,
Most of the people and the health workers actually,
mm,
that stress for me as me,
mm,
that's what I think it kills. It's the one that kills first
mm.
before even other symptoms come in to kill you.